News 13 anchor Frank Fraboni is manning our digital desk. He'll explain how you can be a part of the discussion. Frank?
Thank you, Mark. Folks at home can get involved by going to our facebook.com/news13 site and giving us their comments and questions. You can also do that at Twitter at WLOS_13. We also have a hashtag where you can get involved with the discussion. That's hashtag WLOS Town Hall. Now, we've been collecting comments and questions and feedback from the public for weeks now leading up to tonight's Town Hall. We have some of those questions for you. We're going to share them with you throughout the broadcast, but certainly we want to invite you to be a part of this conversation in this Town Hall meeting. So please send us your questions and your comments through Facebook and Twitter, and we'll be looking for those, and we'll be sharing them with our audience and with Mark, and of course with our panelists who will try to answer all of your questions. So we look forward to that from our viewers at home. Now, let's begin first with a look at the screen, and we'll show you some of the questions and comments that we've received thus far. It may be far from perfect, but you have to start somewhere. All Americans deserve affordable health care. That's from Anna. And then we've had others like, if it were so great, why are Americans being forced to buy it? My insurance for my family has increased and will increase more in 2014. But hey, someone has to pay for the uninsured. That came from Chris. We'll share more of these with you as time goes on.
I know a lot of folks at home want to be a part of this important discussion, so let's go to our digital desk. Frank, what do you have for us?
Mark, the Facebook page has been blowing up. We've just taken a snap poll, and we have the results. This is to that question you asked at the beginning of the program. Do you agree with this statement? Americans have access to quality health care at affordable prices. And according to our this is a non-scientific snap poll of those people who responded. 54 said no, and 1 said yes. And I'll read to you just some of the comments that they posted along with those answers to the poll. Terry writes, less so with Obamacare. Pat says, not under the ACA. And we have a lot of no's listed here. Here's not with Obamacare from Sharon K. Cloud. And the strong survive from Damien. Now, we want to share with you a question that came in earlier this week from our website that somebody emailed us. We want to put this up on the screen for you. And this question comes from Berlinda Deal, who is in Swannanoa. And she writes, why are federal employees in Congress exempt from this insurance coverage? Is it not good enough for them? Mark?
But a lot of folks at home have questions, so let's go to our digital desk. Frank, what do you have for us?
Well, Mark, you are absolutely right about people wanting to weigh in. We have over 500 posts now on our Facebook page. I'm going to share a couple of those with you, as well as what we're getting on Twitter right now. On Facebook, Ashley Moore Priest writes about whether or not we have affordable health care. She says, no. This time last year, my husband and I were paying $56 a month for the best plan Cigna had. Now we had to go with BCBS and having to pay $482.49 a month for the lowest amount of coverage. We have to choose between health care or paying our rent. Healthcare won. Another comment comes in from David Joe Miller. There is no such thing as quality health care at affordable prices. It's not Obama. We didn't have it during the Bush dynasty or Clinton era. Healthcare needs to be overhauled. ACA is nowhere near perfect, but it's a start in the right direction. It's going to be painful, but in the end, when the dust settles and tempers ease off a bit, I truly think they'll be able to shape it up into something doable for all. Now let's take a look at what's coming in on Twitter right now. We're getting some questions there as well. And one of them is from Ashley Ann Larson. She says, to Leslie, 99% of the premiums exceed the total income that people receive. We've got some other comments there, but I want to show on the screen a couple of comments that came in to our website. This one comes from Tammy Blevins. My employer will be freezing our paid time off accrual and giving no raise this year because of it. Yeah, I love it. And also Robbie Brackett writes, people need to read the law. Don't go by what people tell you, and educate yourself on what is truly happening. We also have a question from Twitter, and this is from Joe Stafford. And he posted in our town hall at hashtag WLOS Town Hall, and he writes, my wife is on Medicare. Do I have to include her income when trying to figure out coverage?